Hi, we're here to introduce the new PCS cleaning technology. It's a chemical-free cleaning system. It's going to make your job a lot easier to clean 90 to 95% of your daily cleaning. I will start to talk to you about how to fill up the buckets. We have a bucket here that's easy to fill. There's lines here that have a number of liters that you fill up to. You simply fill the bucket up to the 3-liter line, and then you will take the PCS bottle. To measure the amount of solution, you simply open up the left cap. When you squeeze the bottle, it comes up the left-hand side here, and it fills up the bottle. What I've done here is I've just pre-marked how much solution these buckets take to make it easier, and you only fill it up to just under ½ an ounce. And there are markers on the bottle here that you can fill up to. Once you do that and you tip the bottle over, only what's in this reservoir here will empty into your bucket. The rest of the bottle will not. You just stir it, and then you can put your microfiber cloths in and let them soak in the solution. And you're then ready to walk around the facility with your floor squeegee and your bucket of microfiber cloths, and you can clean, like I said, 90 to 95% of your daily cleaning. I will start with the floor squeegee. So we're now going to demonstrate how to put the reflex floor cloth on the squeegees. The reflex floor cloth will be the blue colored microfiber cloth, and it will be folded in your bucket ready to use. And it will also have inscribed in here the reflex tool, and it will be just the same size as your squeegee. The other cloths are, you have green for all-purpose cleaning. You do have red for washroom and toilets only. I will start by demonstrating how to put the cloths onto the squeegees. What you want to do is you want to hold the squeegee with your dominant hand, so your right hand. And you want to hold the squeegee right at the base here with your non-dominant hand, which is my left hand. And I simply put the cloth onto the squeegee head, and the gravity will just hold it there for me. And I continue to put the clips on. So, switch my hands. And now you're ready to use the floor cloth. How this works is the pressure is put on the squeegee, and this is where you're cleaning along the line of the squeegee. What you can do is you can adjust the handle. It's just a simple twist with one hand. Half twist, half turn. Bring it up to just below your chin is usually the comfort level for the use of this, so that it's comfortable for you to use. And now it's tight and it's ready for me to use. So the pressure being put on the squeegee, this is where you're cleaning. So what you want to do is move in one direction only in sort of a figure 8 or a letter S motion, so that you're cleaning where the squeegee head is, because that way the back of the cloth is going over an area that's already cleaned where the squeegee is. So after you do some mopping, you will know that it starts to drag a little bit, and it will make some noise, some friction. The cloth will be drying out, and you will then need to, once this line is dirty, we just simply move it back 1 inch and continue to clean. And it's almost like having a new cloth. You can keep doing that until the one side of the cloth is dirty. You will then flip it over, and you can do the same on the other side. So this will save you a lot of time. We can probably do most of the washroom here with probably just one cloth, depending how dirty it is. And you'll be able to tell by looking at the lines, or you can feel how it drags and how it dries out. So what we'll do is we'll just demonstrate now the motion of using this. The trick to this is to have the squeegee upright this way. If you do keep it at an angle, it's just going to be harder on your body to use, and it will slip along the cloth. So this actually teaches you to use better ergonomics, not hurt your back as much, and it'll be way easier to use than a typical mop and bucket system. So we'll demonstrate it now. So I'm going to stand upright, not use too much force, just grab the handles lightly, and just walk back and forth. just like that. And not go too far outside of my body. I'm going to stand up straight and just use my shoulders to maneuver this. And I can already hear that it's starting to dry out a little bit with the friction. So what I will do is just move it back about 1 inch and keep the handle upright and keep going. I will now show you the different lines we're getting on the cloths here. As you can see, this side has been, we've got a few dirty lines here. It was a bit of a dirtier floor, so the cloth did dry out a little faster. Now with this floor being a little bit dirtier and a little bit having more grout, what we want to do is we want to carry a squirt bottle with us with the cap flip top and just squirt it on the floor as we move along so that it lets us have the pressure of the squeegee down on the cloth and it doesn't slip as much. And that's how you use the floor cloth, and we're now going to show you how to clean the rest of your facilities by wiping down the surfaces. We're now ready to clean the rest of the facility. You've got your microfibers in your bucket, and we've got it color-coded again. So what we've got here is green cloths for all-purpose cleaning. And what we're going to also do is use the ATP meter to do a reading of before and after cleaning, just to validate the cleaning process of the PCS MicroClean chemical-free cleaning. Just to show to us that we don't need chemicals to do 90% of our daily cleaning, and we're also actually sanitizing. The ATP tool is a tool that hospitals and many other organizations use to validate their cleaning process. What we do is we will use a swab and do a small testing of an area. You put the swab into the machine, it does a reading, it takes 15 seconds to do a reading, and it tells us the level of soil load and bacteria load on the surface. The number it will give us needs to be as low as possible. So between 0 to 10 is acceptable in healthcare facilities. Anything above 10 is usually not acceptable. So what we're going to do now, we're now going to do our initial swab test of the before our cleaning. I'm just going to do a small 2x2 area here. It'll take about 15 seconds to do the reading. Got a reading of 36, which is well above where we want to be. So we're now going to clean the area and do a reading after. We're going to pull out a cloth and clean our sink area here. Again, we're not using any chemicals here. The microfiber is doing most of the work. So it's safe to use on any surface. Now the reason I have a dry cloth with me is because surfaces like glass, mirrors, and stainless steel will need to be dried immediately, or it will leave a watermark. So what we want to do is we want to keep it nice and shiny for our clients. So we're just going to wipe it clean so that we don't leave any watermarks. We're going to do that with the glass as well, just to give you an example. Now for the glass, I could also keep a small squeegee handy and just wipe the mirror down. That's another way of doing it. But I'll just use my dry microfiber for this demonstration. And we'll let that dry nice and clean. And with microfiber, we're not going to leave any lint or any particles on the surface like you do get with most paper towels and cotton rags. The reason why we've got the microfiber folded in this way is that it gives us 8 different sides to clean with. You want to use the entire surface of the microfiber to clean, because that's what grabs and holds the dirt and bacteria. So you don't want to scrunch it up. You want to lay it flat on the surface and clean to the best of the microfiber's ability. When you feel that that side is dirty, and you can usually tell by if it drags on the surface or if it looks dirty, you just flip it over and use the other side. Once that side is dirty, you fold it inside out and you have two more sides. And that's just one side of the cloth. When these two sides are dirty, we flip it over and turn it inside out. We now have 1, 2, 3, 4 more sides, so 8 sides. And you're going to go a long way with one microfiber. So now that we've cleaned the area that we just tested, we're going to do a secondary reading and see how far down we can bring the number down from 36. Okay, we've done the cleaning on the sink. We're going to do a secondary reading now on the same area to see what the reading is. So I'll take another 15 seconds to do the reading. The initial reading we got was a 36. We've got it down to a 2, which is acceptable in most healthcare facilities. So this just validates that we don't need heavy-duty chemicals to do our cleaning. We just simply used microfiber and the PCS chemical-free solution, and we're able to do most of our cleaning. And we've also sanitized. This is healthcare level cleaning and sanitizing.